Good morning and welcome to the May 18th edition of Issues That Matter. And today we're going to be covering, well, the topic is too broad to be covered by saying just one thing. What we're going to be doing is we're going to be talking about complex regional pain syndrome and reflex sympathetic dystrophy. Now, if you think that's a mouthful, you're right, it is. Strap in and get ready for a show that's going to be packed with information. If you need a pad of paper and a piece of paper, a pad of paper and a pen to write it down, you're welcome to it. My guest today is CLICHE. Carol, welcome.
Thank you so much for having me here.
It's our pleasure. This is what we're here for. You have it. You have complex regional pain syndrome.
I do.
Would you say that you also suffer from reflex sympathetic dystrophy?
Well, you know, it's actually the same thing. Complex regional pain syndrome was formerly known as reflex sympathetic dystrophy.
Okay.
Makes it really confusing sometimes. And you may hear me call it CRPS or RSD because they shorten it to the letters.
The acronyms.
But it is the same thing.
And we live in a world of acronyms these days.
Yes, we do. You know.
How far back do you go? When?
I have had this for years, but have just been recently diagnosed. And it's why I wanted to come on the show. I believe that here in Maine that it's really an underdiagnosed disease. It's an incurable disease. But you can get it from just having a simple injury like a sprain or a strain or fracture from surgery. And so a lot of people think that, well, that fracture didn't heal right, or, you know, I never recovered from that surgery I had on my wrist or my knee, when actually it may be RSD. And so that's one of the reasons why I wanted to come, to start to get some community awareness about this disease and what it is and the symptoms of it, and to try to get the medical community involved in trainings and diagnosis of this disease.
Now, we had some conversation about the number of doctors that treat this illness or this condition, however you want to refer to it. Yeah. There seems to be a lack of doctors.
There is, especially here in Maine, but also nationwide, I think. You know, they say that people go to 6 to 8 doctors before they're diagnosed, and it can take years before you get this diagnosis. And so that's why it's so important for people to learn the symptoms and the signs of RSD and become more aware of it.
What are some of the symptoms?
The one thing I'm going to say for the audience, it's going to make it really easy as far as an early diagnosis of RSD, or if you think you may have this, is that to Google Budapest criteria. There was a group of pain specialists and doctors in Budapest, Hungary in 2003 that came up with this standard for diagnosing RSD. And it is a group of signs and symptoms that you would have, because there's no definitive test you can't go have blood work drawn and have it come back with a diagnosis of RSD. So it's the Budapest criteria. And if you Google that, it's going to give you a set of signs and symptoms that have to do with skin changes, color changes, swelling, temperature changes, hypersensitivity. Some people with RSD can't even have a shirt touching that part of their body, or blankets on top of them at nighttime. And some people have the hypersensitivity to noise. Like for me, I mean, my dog, the shrill bark of my dog actually elevates my pain levels with the RSD.
The what?
The shrill bark of my dog actually elevates my pain levels. I have a hypersensitivity to noise, to bright lights. And so you may find that you have a lot of really kind of what I call weird symptoms, but it is all part of this disease called RSD. And RSD it's a disease of the nervous system, of the sympathetic nervous system. It involves the autonomic nervous system, the central nervous system. But like I said, it's really not well known, and not in the medical community, and not, your average person just wouldn't be aware that they may have this.
I can, I can imagine, I can well imagine this being a very, very difficult condition to diagnose, and part of it is because it's a very difficult condition to quantify a diagnostic.
That's true. I mean, and they say that, RSD can be different in different stages, that you will see it in different stages, acute versus chronic. And it may be different for everyone, and that also makes it really hard to diagnose and for people to be aware of the symptoms that you may have. But the number one symptom is that after an injury, like a fall or a sprain or surgery or a fracture, that you will have this out of proportion pain, that the injury never gets better. It would still be swollen, or you may feel that it's, hot and inflamed, and it doesn't get better.
So it's not something that one could say is captured by the mind. It's not something that's created by the mind. There are physical manifestations.
Yes, there are, yeah. And that's part of the Budapest criteria to being diagnosed, is that you have to have this set of signs and symptoms of the disease in order to be diagnosed with it.
Have you seen progress?
I came to you after I recently went down to Rhode Island. I saw Dr. Pradak Chopra. He's the leading expert in RSD. And his treatment protocols are so much different than anything you could find here.
How might that be?
Well, because he does really he actually helps set the protocols for the treatment of RSD. And one of them it's an IV infusion of ketamine, the use of low-dose naltrexone. And so he has this whole treatment plan that he sets up for you that is really quite different than anything I have come across before. And it changes things, it gives you hope, I think, that, you're going to be able to manage this and to, have a different life. It's incurable. I mean, it can go into remission, but usually remission happens for people within the first months to 1 year. That's why early diagnosis is so important for people.
Now, I know in multiple sclerosis, there was one of the forms that MS can take is relapsing remitting. Mm-hmm.
Well, in RSD, we call it flare-ups.
Well,
yeah.
We probably share much the same vernacular.
Yeah. And, and a flare-up can be brought on by so many different things with RSD. Can be temperature changes. The cold is excruciating for me, but this hot, humid weather is bothering me as well. And it can be stress plays a major role in flare-ups for RSD. So it's really a lot of different things that can flare it up, and it's different for different people. And that's why I said it's really so hard to diagnose, because what works to help one person might not work for another person, and what flares up that disease for one person might not for another. Very much like MS, I think.
You mentioned stress,
Yeah.
and this goes back, this thought that's traveling through my mind goes back to the days that I was first diagnosed and was told that stress is a factor in MS. Mm-hmm. And I thought, this is quite the conundrum. Is stress a factor in MS because of the stress, or is stress a factor in MS because you have MS?
Well, with RSD, research has proven that it affects the limbic brain. The limbic brain is the stress center, it's the emotional center. And so there is some component here, and what brings one on or the other, I mean, I don't know, but it plays a major role in emotions and stress, and people are going to be usually in a flare-up from that, you know. So, but like I said, who knows what brings it on? Is it the stress that brings that on, or is it the RSD that creates the stress?
The last time we spoke, when you were here planning the show, you mentioned that I inquired with you what your background was, whether you had any type of medical background, and you did.
I did, yeah. I used to, well, years ago, I mean, I started out, I was a nurse's aide, I was an EMT and on an ambulance, I used to work in doctor's offices, and I had never heard of RSD. I mean, I had heard, you know, a passing about it, I really didn't know what it was, and when I was diagnosed with it, actually the doctor used the term CRPS, and it was from a doctor I saw in New Hampshire. But when I was diagnosed with it, I had to go home and read about it. I mean, I had to go look it up and see what it was that I had, you know, and there was a part of me that was devastated because here I had this incurable disease that is rated the highest pain syndrome known to man, and with very little treatment options. And on the other hand, I was relieved because finally, after years of complaining of these high levels of pain, and I had the answers that I needed, you know. So there was that balance there of, you know, being really taken back with the diagnosis, but also being relieved because finally I knew what was going on with me. But it took years.
And have you? I probably already covered this, but it's just it's a mind-boggling thought that the medical community has not been able to garner or not been able to advance more rapidly in this area.
I don't have an answer. I mean, I just don't have an answer for that as to why. I think that all of a sudden that it's becoming more well-known, and I think that the things about the disease, the signs and the symptoms, and the fact that it can spread to other areas of the body, 70% of the people that get RSD, it's going to spread to another part of your body. It's going to go to your internal organs and cause other conditions, and you have systemic complications.
I've done enough research on it to be absolutely convinced that this is not something that is a function of the mind.
No.
There are physical realities that bring this stuff about, and it just strikes me that there's a gold mine out there. There's a gold mine to have a doctor here in the state of Maine who specializes in it, and there's probably a lot more people in this state than we realize.
I would love not to have to go to Rhode Island to see a doctor. You know?
And so there's the gold mine is for that doctor who decides, you know what, I can make this work for me in the state of Maine.
Mm-hmm. And to have a treatment facility. I mean, right now there's no treatment facility that does the intravenous medications and stuff that's needed for this disease. That is the modern treatment for this.
So if a person is suffering from pain related to this, where do they go? Where can they go in the state of Maine to receive treatment? Is there a place?
There is.
I know you had mentioned it at one point in our conversation. You mentioned you went to the pain clinic in Kennebunk.
Well, that was years ago, but they didn't diagnose me with the RSD. You know, I went to a pain specialist in New Hampshire, and he was the one that diagnosed me with the RSD. Unfortunately, I only got to see him for a couple of times before he closed his office and moved. So, but you know, there's very little doctors that understand RSD I have found. I mean, I've been to some doctors that when I told them I had it, they actually asked me what the letters stood for. And when you go to have procedures done, there's actually certain protocols that you need to have done, like they should never draw blood from your arm or leg that has RSD in it. They should never put a blood pressure cuff on that arm. And so, and you really shouldn't have surgical procedures because that RSD could spread, you know. So there's a lot of information, and I just found that the medical community just does not know about it. But you know, to go seek help, like I said, you know, it's in Rhode Island.
I would venture to say, and I often make in conversation, I make this point that, you know, relative to multiple sclerosis, most of what people think they know, and this I'll get to turn the clock back. We know a lot more about it today than we did 15, 20 years ago. But 15, 20 years ago, most of what people thought they knew about multiple sclerosis was incorrect.
Yeah.
And as I mentioned earlier off camera, you are now where multiple sclerosis was 20 years ago.
I believe that that's true. I mean, I really do. And I think that, you know, the CRPS RSD is just really becoming more well known. I told you I was contacted to do a clinical study for a drug that they're trying to bring here to the United States. It's used successfully in Italy and has been for years and
Are you going to do it?
years. Well, I need to get the financing to be able to go to Florida to be able to do the study. But this drug company, just the fact that they're bringing these studies here to the United States in order to be able to bring this drug here and get it approved by the FDA, I mean, that is hope for everyone that has RSD. And this drug is used so successfully in Italy that doctors here in the country will bring groups of patients that have RSD to Italy for this drug. It's an IV infusion. It's a 10-day process of IV infusions. And 70% of the people are in remission even 5 years after that treatment.
After one treatment?
After one treatment. So that's promise right there, you know, that they're now doing these studies, clinical studies here in the United States. So to me, that's very promising.
And the reason they can't get it introduced here in our country, in the United States, is because of not being able to get it. The FDA
needs to approve it, but hopefully with these clinical studies, although the study takes 15 months, so it's going to be at least that long.
And and I know that there are stages.
Yes.
I think there were 3 stages in the FDA to get FDA approval. Yeah. And the first stage, you have to pass through the first stage in order to get the second and third stage. And I made this observation to you earlier. You know, it's wonderful that the FDA is the gold standard of the world. It's a great thing. However, it comes with a cost.
Yes.
And the cost ends up being in the lap of the user.
And I think that these drug companies have to weigh out their costs of developing the drug and bringing it to market and everything. And unfortunately, you know, that's just what we're faced with.
And I would venture to say that the fact that they really don't have a handle on how many people have it leaves a drug company playing a game of chance. Yeah. Are there going to be enough people that have the condition to justify that kind of expense to develop a treatment for it?
Yeah. And I told you that this drug company called me back, and they said that as soon as they announced this clinical study, that they were so overwhelmed with phone calls from everyone across the country that they are trying to set up a clinical study site in every single state here in the United States, so that a group of people in every state would actually be able to get this drug. And there's no placebo. usually with clinical studies, they'll do the real drug
Yep.
and then they'll do the placebo, but there's no placebo to this clinical study. You get the actual drug, the actual treatment. So we'll just have to wait and see. You know, right now, their site that they're doing is in Florida. So, but they're trying to expand it just because they had such an overwhelming response of people that with RSD that wanted this drug. So, you know, that's hope, you know, right there. I think that they're going to end up eventually approving this drug and getting it here for us.
So if there is somebody out there viewing the show today and they think they might have this condition, how would they go about trying to confirm?
Well, I think the first part would be to internet search this Budapest criteria that gives you the signs and the symptoms that a doctor would use to diagnose you with RSD. There's the RSD organization. It's rsds.org, and they have a lot of information, research, and you can contact them for information. They even have state-by-state doctors that you can go see that are in your state. Unfortunately, in Maine, there's none they have none listed for Maine.
Is there a doctor listed in New Hampshire?
Yes, the Seacoast Pain Clinic in Somersworth, New Hampshire, is the closest, I think. So
if you think you might have this condition, this disease, however you want to refer to it,
yeah.
it might be a good idea for you to contact
Oh, an expert.
not only this organization, but contact the pharmaceutical company that's developing it to see if you would qualify to
You have to have a diagnosis to be pre-qualified for this study, and you have to have type 1 CRPS. There's two different types of CRPS, so you have to
Okay.
have type 1.
What's the difference?
The difference between the two is type 1 is that there's no known nerve injury. So, you know, from a fracture, from a fall, a soft tissue injury, a sprain, a strain, even surgery. Type 2 is from a known nerve injury. And most of the symptoms of those two types are really the same. They say that type 1 is actually the more aggressive form of the disease, but the symptoms are the same. The severe pain, the burning sensation, the neuropathy, the loss of use of the limb, the swelling, the skin changes. So you may have type 1 or type 2, but pretty much the signs are the same. But for this study, with this clinical study, you have to have type 1.
Okay.
And there's a lot of other things that they qualify you for. I mean, you have to have a doctor that will certify that you have CRPS. So that's one of the other things. But for people that, if you think that you have this, I would really get to an expert that understands this disease. Because if it's the one thing I wish I had done differently years ago, it would be to really seek out expert help that understands this disease. And like I said, if you go to the RSD organization, they have a list of doctors that will probably be close to you and that you would be able to go see. You know.
What would you say, just in our conversation today, it's clear that you face a lot of challenges relative to this disease or condition, however you want to refer to it. What would you say was the most challenging?
Well, for me, it's managing the levels of pain that you have. I'm allergic to narcotics, so I don't take any narcotics for it. And actually, researchers have found with this drug that actually if you take opiates, it actually can make this condition worse. So it's not, it's the pain management aspect of all of this and the disability. You know, you have, just like MS, I mean, you have good days and you have bad days. You have the days of the flare-up, and it can be because the weather is affecting you.
Yep.
that changes everything. It has systemic complications. Mine has gone on for so long undiagnosed and untreated that I have some other really major complications from this disease as it spread through my body and into my organs and stuff. So, early diagnosis, I just can't stress that enough, how crucial and important that it is. But it's living with a disability and having good days and bad days and the emotional roller coaster ride that goes along with everything of having your life turned upside down and inside out,
Well, I'm going to trap you.
Uh-oh.
I'm going to trap you. I've mentioned to you more than once or twice about being on the show, maybe co-hosting it, maybe hosting it. Here's the trap.
Uh-oh. And you got me on air.
My own personal experience is that since I've been involved with this show, it has helped my mind cope with the challenges. I would suspect, because I'm not by any stretch of one's imagination any type of unique individual. And what uniqueness I might have is probably the negative aspect of living. In any event, I would suspect if you were to wrap yourself up in doing something like this to advance that cause, you might find that to be therapeutic.
I think that, and we talked a little bit about this, for me, if I can make it so that one person doesn't have to live the nightmare that I lived for years being undiagnosed and with this condition, that I would love to change that for people. I'd love to be an advocate for this disease, and to get the awareness into the community, into the state, and to get really comprehensive training for the medical community.
Well, I happen to know that the director of this studio would be more than happy to have a show on the rolls of the shows that this studio produces to talk about this topic. And I think you probably made a good enough impression on him right now that he would probably be saying, she'd be a good host.
Well, I don't know. You've got me on air here. We'll see, But I think,
I don't want to put any pressure on you.
Yeah. The only thing is that like I said, I feel like my purpose behind this is really to early diagnosis, and my goal to bring a comprehensive training to the medical community here and this awareness campaign so that people can get diagnosed early. They say that with early diagnosis, the person within the first 6 months to 1 year has a greater chance of being in remission. But once that disease switches to being chronic, and it may be less likely right now with the medications and the things that we use for it. But so it's just getting out there and trying to spread the word about what this is all about, and bring some trainings and information awareness here to it.
Well, as a host of this show, I can say that based on how you conducted yourself on this interview, you'd make a heck of a good host.
I'm a nervous wreck.
It doesn't show. And trust me, I've done this show now for probably 3.5, 4 years. I'm still nervous.
I know.
And I'm often told that I'm a wreck. But no, I think it's something you should seriously consider. And with that, do you have anything else that you would like to say?
The only thing is that I specifically set up a Facebook page for this as so people would be able to contact me and get information on complex regional pain syndrome. And that Facebook page is CRPS-RSD Pain Management Network. And you can message me through that Facebook page, and if there's any help that I can give you to find resources that you feel that you may need, I'd love to be able to do that.
Well, Carol, Thank you very much.
Thank you very much for having me.
You've been a great
Thank
guest. You've imparted a lot of very valuable information.
Thank you so much.
And
Thank you.
I'm appreciative of it. You don't have to thank me. Thank the people in that
know.
room that make the
all
magic
of you.
happen.
They've been wonderful here.
And
Thank you.
folks, that's a wrap. Have yourselves a wonderful day. I think it's going to be a little bit cooler than it was yesterday. And I'll tell you, yesterday I was in my car. My car has one of those exterior thermometers, and it hit 97 degrees. And I got to believe that 97 degrees in May, that doesn't happen very often.
No.
But in any event, have yourselves a wonderful day, and be safe out there, and simplify your life. Take advantage of the area that we live in, the rest, relaxation, and the tools that we need, and the hospitals and medical treatments that we have available to us right in our own backyard. Have a great day. Bye-bye.